From VOA Learning English, this is the Health Report. The World Health Organization, or WHO, says the use of surgical childbirth is growing worldwide. Surgical childbirth is when a woman gives birth with the help of an operation, also called a cesarean section. WHO officials say the operation is becoming especially popular in what they call high and middle income countries. Doctors may advise a cesarean birth, also known as a C-section, when normal childbirth would put the mother or the baby at risk. But the WHO says it is concerned about the possible abuse of this life-saving surgery. It supports C-sections when they are justified medically because it can save lives. But the WHO says when C-sections are performed without medical need, mothers and their babies are put at risk. Health experts say the ideal rate for C-sections is between 10 and 15% of all births. New studies show when the rates go below 10%, mothers and babies can die if the operation is not available. Dr. Marlene Tennerman is director of the WHO's Department of Reproductive Health and Research. She says that a C-section is generally a safe operation and advisable when a traditional vaginal delivery puts the baby or mother in danger. But she adds, health risks do exist. She says changing opinions and other lifestyle issues generally are the reason for what she calls an epidemic of C-sections. These operations, she adds, are easier for doctors and hospitals because planned C-sections help them better control their planning. She says many women choose a C-section because they do not want the pain of childbirth or the possible physical after effects. For VOA Learning English, I'm Carolyn Presutti. From VOA Learning English, this is the Health Report. The World Health Organization says about 3 billion people use solid fuels for heating and cooking food in their homes. The practice creates dangerous indoor air pollution. WHO officials say more than 4.3 million people die from household air pollution a year. Most are in developing countries. WHO officials say indoor pollution leads to early deaths from stroke, heart and lung disease, childhood pneumonia, and lung cancer. Women and girls are the main victims. The WHO says these diseases can often result from high levels of fine particulate matter and carbon monoxide released by burning wood, coal, animal waste, crop waste, and charcoal. Carlos Dora is with the WHO's Department of Public Health, Environmental and Social Determinants of Health. He says people should not use unprocessed coal and kerosene fuel indoors. He says opening a window or door to let out the harmful air will not correct the situation. It only will pollute the outdoors. The United Nations found that more than 95% of households in sub-Saharan Africa depend on solid fuels for cooking. It says huge populations in India, China, and Latin American countries such as Guatemala and Peru also are at risk. Agency experts say some safe and low-cost technologies are available. In India, you can buy an induction stove for about $8. And in Africa, you can buy a solar lamp for less than $1. But this, the agency says, is just a start. It is urging developing countries to use cleaner fuels and increase access to cleaner and more modern cooking and heating equipment. For VOA Learning English, I'm Carolyn Persutti. From VOA Learning English, this is the Health Report. Telemedicine is the name for when doctors give advice to patients by telephone or the internet. It also describes when healthcare providers in rural areas connect with specialists in big cities. Telemedicine has existed for a long time, but the rise of smartphones, tablets, and webcam-equipped computers is raising telemedicine to new levels. Some healthcare systems in the United States now offer virtual urgent care. Patients see a doctor by video chat without having to leave home. Diana Ray is a nurse educator in the northwestern state of Washington. She recently demonstrated how virtual urgent care works. She used an iPad tablet and Skype, the video chat service, to have a virtual appointment with Dr. Ben Green. He had the patient describe her symptoms. Dr. Green decided that the problem was a sinus infection after having her perform a facial exam that he demonstrated. For medicine, he prescribed an antibiotic. Dr. Green says about 3 out of 4 of his patients have health problems that can be treated like this, through virtual urgent care. That means a video chat could replace a visit to the doctor's office in some cases. Dr. Green treats patients by Skype for the Franciscan Health System, based in Tacoma, Washington. It operates hospitals and other healthcare facilities. Franciscan charges $35 for this kind of virtual house call. That is much less than the cost of going to an emergency room, a doctor's office, or an urgent care clinic. After trying the video conference, Diana Ray says she would have been happy to pay the $35 when she was recently home with a bad cold. For VOA Learning English, I'm Carolyn Persutti.
From VOA Learning English, this is the Health Report. Do you often start your day feeling tired? Do you ever fall asleep at work? Do you sometimes feel out of it, as if your brain is still asleep, even though your body is awake? If you answered yes to any of these questions, you might be suffering from what some researchers call social jet lag. Till Roneberg is a German chronobiologist, a scientist who studies how living things adapt to and are governed by periods of time, such as lunar or solar cycles. Mr. Roneberg says that many people are working at times that do not match their body's natural sleep-wake cycle. This natural cycle is called the circadian rhythm. Mr. Roneberg says when your work schedule conflicts with your body's inner clock, it can lead to extreme tiredness, similar to jet lag. With jet lag, people feel extremely tired when they travel long distances in a short period of time by air. Till Roneberg led researchers in a study at Ludwig Maximilian University in Munich, Germany. They studied social jet lag among workers at a steel company in Europe. Factory workers were given work times that matched their natural sleeping habits. Changing the workers' schedules to fit their lifestyle made them feel more rested and improved their sense of well-being, says Mr. Roneberg. But the people who worked at night did not report the same level of improvement. Mr. Roneberg adds that employees who wake after better rest are more productive. The journal Current Biology published the study. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. The World Health Organization has declared the Pakistani city of Peshawar the world's largest reservoir of polio virus. And WHO officials fear Pakistanis could face travel restrictions unless steps are taken immediately to stop the disease from spreading. Researchers studied all the cases of poliomyelitis reported in Pakistan last year. They found that almost every case could be linked genetically to the polio virus often reported in Peshawar. Polio mainly affects children under 5 years of age. The virus is passed through food or water. The virus reproduces in the body and later invades the nervous system. The disease can lead to loss of muscle control in part of the body. The WHO study found that 90% of Pakistan's polio cases could be linked to the virus in Peshawar. In addition, 12 of the 13 polio cases in Afghanistan were also linked to the city. Elias Dorey serves as the WHO's emergency coordinator for polio in Pakistan. He says local officials need to take urgent action to strengthen polio vaccination campaigns. He says the situation in Peshawar threatens the gains Pakistan has made against polio. And he warned it could also harm international efforts to end the disease. He also noted an increase in attacks on vaccination workers in Peshawar and other areas. Taliban militants often attack polio workers in Pakistan. The militants accuse them of being American spies or part of a plot to keep Muslims from having babies. Most of the attacks have taken place in Peshawar. The city is close to Pakistan's tribal districts. Extremist groups operate bases in those areas. For VOA Learning English, I'm Carolyn Presutti. From VOA Learning English, this is the Health Report. Zambia has one of the highest rates of cervical cancer in the world. 90 of every 100,000 Zambian women get the disease. The Zambian government recently launched a program to vaccinate schoolgirls against the human papillomavirus, or HPV. The virus can cause cervical cancer. HPV can spread through sexual contact. The government hopes to vaccinate schoolgirls between the ages of 9 and 11 against HPV. The program was launched in May at several schools. One of them is the Kalingalinga Primary School in Lusaka. About 100 students there received the HPV vaccine. Euphrasia Mweshi Mutale is a teacher. She was involved in efforts to inform the community about what was expected to be a difficult subject. Ms. Mutale is happy with the early results. She says people involved in the program met with parents and teachers to tell them why it is good to vaccinate the girls. She notes there have been no reported side effects from the vaccine, like high body temperature or skin discoloration. Mulindi Mwanahamuntu is director of the Cervical Cancer Prevention Program in Zambia. He says health officials wanted to vaccinate 25,000 girls, but he says there was some resistance from churches and other groups. Zambian and international health officials are working to end the resistance by educating communities about medical issues. Zambia is third on the World Health Organization's list of countries with the highest death rates from cervical cancer. The country also has the highest cervical cancer rate in Africa. For VOA Learning English, I'm Carolyn Presutti.